We rely on hospitals to care for the sickest COVID patients, but some doctors and nurses are choosing not to get the vaccine, and it's important protection. Tonight, Susan Elcoury is working for you, exposing how hospitals aren't immune to vaccine hesitancy.
This guy was so young, didn't have the cough, he just died all of a sudden.
A devastating reminder as hospitals fill with COVID cases.
It's no joke, they're sicker, they're younger.
Bringing new urgency as the Delta variant spreads.
Majority of our population, I think, in our ICU is unvaccinated.
But patients aren't the only ones hesitant to get the vaccine.
I actually got it yesterday.
Sarah Haney is an ICU nurse at Baptist Health in Little Rock. Back at work the day after her first dose.
When it first came out, the vaccine, I was pregnant, so I didn't want to get it because I had already had a miscarriage that year.
Her concern changing as the recent surge put more pregnant women in intensive care.
They just get this new variant and it just takes them down and get on the vent, and it's just awful.
The way things stand, when you walk into most hospitals, there's no way of knowing if the doctor, nurse, or staff around you are fully vaccinated. The Department of Health and Arkansas Hospital Association aren't tracking those numbers, so we went to the source.
Working down a list of the 13 biggest hospitals in central Arkansas, asking each how many employees got the vaccine.
I'd love to see it at 100%, but we haven't hit that yet.
In all, 7 hospitals are sharing. UAMS and CHI St. Vincent top with almost 90% of staff fully vaccinated. Others fall much lower, like Unity Health, where almost half of employees aren't vaccinated.
We would like nothing more than to give one of our teammates a vaccine.
Unity's chief medical officer, Dr. Roddy Lockala, got his shot and is now sharing another picture.
The vaccine is very effective at preventing a severe outcome,
urging his staff to get their dose.
Has there been any conversations about requiring vaccinations for employees?
There has. There's been conversations, and we've seen other hospital systems require COVID-19 vaccines. We have not. I wouldn't want to talk about any of that, on the air, but yeah, we've talked about it.
At UAMS, videos about the vaccine play on screens throughout the hospital.
The uptake has really been pretty good.
Dr. Robert Hopkins says many employees are using these.
A name tag or a sticker that said I've been vaccinated,
which he believes is part of what's helping drive the hospital's higher vaccination rate, as more see it as a professional responsibility.
If I'm here to provide health care to you and I'm unvaccinated, then potentially I place myself and my family at risk, but I also potentially place you at risk.
It's no secret vaccine hesitancy is a dangerous problem across Arkansas. The CDC ranks the state one of the worst for vaccination rates. That's part of why the Arkansas Hospital Association sent this letter saying it strongly supports hospital policies that require all hospital employees and clinical team members to be vaccinated. Children's Hospital took the first step, requiring vaccines for new hires and hospital leaders. And at the VA, employees working with patients have 2 months to get the shot.
I felt as a nurse that's my duty to get the vaccine.
While some welcome a strict approach,
our responsibility is to play it as safe as possible.
Others on the front lines,
She spent 15 days in the ICU.
are watching their coworkers end up in hospital beds.
She was like 2 liters away from getting intubated, and it was just, I didn't want to end up in that spot.
Realizing there's too much at stake to wait.
You would rather have a little bit of, side effects from a vaccine than getting COVID and ending up in here and possibly dying or losing your loved one.
I did follow up and ask hospitals what's preventing making vaccines mandatory for employees. Several mentioned waiting for full FDA clearance beyond the current emergency use status. Back to you.
Susan, thank you. You can see all the questions we asked hospitals, who responded, who did not. That's on our website right now. If you have something you want Susan to investigate, call the number on your screen or email us.